Hello, my name is Gotz. I'm based at the Queensland Brain Institute in Queensland, Australia. And today I would like to talk about therapeutic ultrasound as a treatment strategy for improving cognition in both physiological and pathological aging. My lab has a major interest in Alzheimer's disease, so we have shown that by removing A beta and tau using therapeutic ultrasound, that this improves cognition. So we have been using therapeutic ultrasound on its own with microbubbles to remove amyloid and restore memory functions in Alzheimer's mice. In different Alzheimer's mice, we have shown that it's also possible to some extent to remove tau and to partially restore memory and motor functions. And at the bottom of the slide, you see an example where we have been using K3 tau transgenic mice, which have a tau pathology, and in a sham-treated mouse, with tau pathology is visible, as shown here with the 88 antibody. However, when we use either a pan-tau antibody on its own or scanning ultrasound on its own, this pathology is gone. Now we have further been using therapeutic ultrasound in combination with therapeutic antibodies, either an aducanumab analog or an anti-tau antibody. And generally what we find is that the combination treatments compared to the single treatment arms are more effective. So when we look at pathological as compared to physiological aging, we find that several rejuvenation strategies have been applied. Calorie restriction, exercise, injection of blood plasma, and therefore, considering that ultrasound restores cognition in Alzheimer's mouse models, we asked whether it's also possible to restore cognition in normal aging. We used wild-type mice, which were aged to 20 to 22 months, and treated them 6 times weekly with scanning ultrasound, with and without microbubbles. We analyzed these mice in the active place avoidance test, the spatial memory test, and we have previously shown that these mice perform perfectly at 4 to 9 months of age. They start to deteriorate at 18 months, and by 20 to 22 months, this form of memory is completely gone. We used the TIP system to deliver ultrasound and included a naive mice and sham-treated mice as a control. And we found that by applying ultrasound with, but more so without microbubbles, we were able to restore cognition to levels we find in normal mice, so to levels of naive wild-type mice at 12 months of age. We have also included 1 weekly treatment and 3 weekly treatments compared to 6 weekly treatments, and found that there's a progressive improvement with treatment sessions. We have performed a lot of analysis, including what I'm showing you here, biochemical and the proteomic analysis, by fractionating the brain and isolating the postsynaptic density fraction. We find that there are changes to the NMDA receptor reflecting improved signaling. And this is also found and supported when we do a quantitative proteomics analysis using SWAF. So together with additional analyses performed by us, this indicates pleiotropic effects, including synaptic changes induced by therapeutic ultrasound. So our work adds to several studies that highlight the neuromodulatory potential of therapeutic ultrasound in different species and experimental paradigms, and the possibility of using ultrasound on its own to enhance cognition in physiologically aged humans, a cognition enhancement tool in other words. This slide summarizes the collaborators, appreciates the research support, and also indicates in blue those who have been involved in the study. Thank you.